Hello, everybody, and welcome to my show, Adulting with Landa. Today, we'll be talking about mental health, specifically depression. I want to welcome our guest, who is known by the name of Palesa from Workforce. So, she will be discussing everything depression. I hope you will enjoy this episode. Now, depression is noted as a mental health condition that involves persistent sadness and loss of interest in activities. It can affect anyone and is different from normal mood changes. The symptoms include feeling sad, hopeless, or worthless, losing interest in activities you once enjoyed, significant changes in appetite and/or weight, sleeping too little or too much, decreased energy or increased tiredness, difficulty thinking or concentrating. Now let's get into it.
Glad to be here too as well. Thank you so much for the warm welcome.
Okay, so we're just gonna get into it quickly. Please just tell us about yourself briefly.
All right, so my name is Palesa. I'm a registered counselor and I've been doing this for almost 6 years now. So I've been working in the EAP space. So the EAP is the employee wellness programs that we do. For companies. So I've been assisting with counseling services. I've been a registered counselor there. I'm now a CRM there, so it's a client relationship manager there. So I've been in the mental space for a long time now.
Okay, that's wow, that sounds like a lot. Sounds like you've been doing a lot. Um, Tell us briefly, like, what made you want to be a counselor?
So I have a passion in assisting people when it comes to mental health challenges. Because remember, mental health is something that is commonly not talked about. And people don't even understand when we talk about mental health, they already assume that depression and anxiety is what constitute mental health. Whereas you're trying to say, no, it's not just that. We're looking at your psychological challenges, we're looking at your social challenges, we're looking at your
Mm,
environment, we're looking at you as a person. How are you able to cope, adapt, and to all the changes that are happening to yourself? So that is what drew me into the mental space to allow people to be able to express themselves as well, to be able to, understand that some symptoms that they're experiencing is a reaction to this mental space and where they are at as well.
okay. Wow, that sounds so impressive. Sounds so like I'm actually glad. Like, have you always wanted to be a counselor, or is it something that you found along the way, maybe after school, after seeing maybe other psychologists expos or after university? Was it something you've always wanted to do?
So, weird enough, I wanted to be a psychiatrist. I wanted to just be in the medical profession. And when I saw a opportunity open itself in the psychological space, in the psychology space, sorry, that's where I found my passion. Then I was like, oh, let me just go there, try it out, see how it will work out.
Yeah. Okay. Um, just tell us, have you ever dealt with depression?
On a personal level, right?
Yes. Have you ever dealt with depression? Has it ever
Yes.
been something that you have suffered from?
Yes, so I have suffered from depression. So as much as they like to think, psychiatrists, psychologists, registered counselors is supposed to be able to handle this, it has hit me once or twice in my life, and and yeah, so I've had a little experience of depression, anxiety. Yeah.
Okay. Just take us through that period of your life. What happened?
So I would say for me, it's more of a major depression disorder that I suffer from, and it comes and goes. Okay, let me just say it's seasonal. It comes and goes from time to time. So I do get those moments where I just nothing happens, nothing triggers me in that point, but I find myself unable to actually cope or unable to function fully as well. So I find myself unable to respond to the natural demands in life. So any stress that triggers me at that point as well. So remember I said I woke up with no triggers, but the moment I also get triggered along the way as the day progresses, it pushes me off as well to the dark space as well.
Mm.
So it is a very uncomfortable feeling. It is a feeling where sometimes a lot of people feel hopelessness in it. They feel like, you know what, whatever I do, I'm still gonna be stuck in this mental space. So that's where I usually used to find myself as well.
Mm.
And weirdly, oh, oh sorry. I
Mm-hmm.
was about to say, and weirdly, sometimes there's what we call functional depression, where a person is depressed, but you won't see it. So a lot of people would assume that, I'm coping because I could smile, I could laugh, I could still be a fully functioning member of society, but deep down, I know that I'm going through a period of sadness.
Mm. How did you get through it?
So there's a lot of treatments that I take from time to time. So I do go for counseling myself. So if it gets too much, I do know that I need supervision support. So if I have a lot of caseloads that I've dealt with, a lot of triggering cases that I've been through, then I know I need to debrief with someone. I need to just offload whatever I'm going through. So the challenges that I'm facing, I need to offload because as much as I say I'm okay, I'm internalizing them and I'm making them me as well. There are times where there was a period in my life where I was actually referred and I was in a psychiatric space for a while. So for that 7 day period, I would see both a psychiatrist and a psychologist as well, so that I can be taking medication and still follow the psychosocial treatment as well. So I
Okay.
was integrating all of them.
Okay. And that helped, right?
Yeah, it did. It did.
It, okay, I'm glad. I'm actually glad to hear that. And I feel like for people that will be listening will understand that, you know what, even counselors, even psychologists, even psychiatrists also go through psychological issues. So it's something that should not be shied away from. It's something that should be treated should you ever suffer from something like that. So I'm glad that you were able to speak about it. I'm glad that you actually went and you seeked help for your depression, and that it actually helped you. Um, just take us through the types of depression that there are, please.
Okay, so there's different types of depression that people go through. Um, we have your major depression symptoms. So this is your MDD. This is a period where it lasts more than 2 weeks. So we see a person going through the cycle where they experience severe reaction of the sadness. You find those people isolating themselves. You find them not being able to function. You find that they cannot eat. There's no base self-care as well. So a lot of people in this state, they physically react to the depressive state as well. So if we were to speak to someone like this and we see that there's a lot of depressive symptoms happening and it's persistent for more than 2 weeks, so they tick all the box in the DSM-5, then we know that okay, this person is experiencing a major depressive symptom as well. So we also have a persistent depressive disorder. So this is a chronic depression that lasts 2 years or more with few. It's not as severe as MDD, but the person still goes through the cycle of depression as well. So it's persistent. It lasts more than a few months or so. So we know that this person can go to a state of being okay, and then after a period or so, they go back. So it's a persistent symptom as well. We have disruptive mood dysregulation disorder. So this is where a person has temper outbursts. And mostly we see this kind of symptoms in children. So they have tantrums. So remember, children are not able to say, I'm going through a depressive period. Children are
Mm.
not able to pinpoint when they actually are depressed or are anxious or are going through something. So what they do is they react by having sudden outbursts, being irritated, being away from people. Some other children, they just don't want to associate with other children. So we can see this happening from the age of 6 to 18. And even children younger than that do experience symptoms of depression as well, right?
Mm.
We also have the premenstrual dysphoria disorder. So this is severe mood disturbances before the menstrual cycle. So before menstruation, a lot of women do go through these hormonal changes. And after they've gone through the whole period of the menstrual cycle, they are able to regulate themselves better. So they improve as well. Right. We also have what we call the substance medicated induced disruptive disorder. So this can be caused by any substances that an individual use, and we mostly see it when there's withdrawal symptoms. So when a person is taken off drugs, they have severe depressive disorders as well that just kicks in as well. We also have a depressive disorder due to other medical conditions. So this is when someone who has experienced, for example, stroke, they're going through cancer, so hypothyroidism,
Mm.
all these other medical conditions have an impact on the person's psychological well-being as well. So the person's reaction to those medical conditions, if it goes through the depressive state, this is when we can say, okay, this is due to the fact that they've been diagnosed by a certain medical condition as well. So we do have other specified disorders that do not meet the criteria for the DSM-5 depressive disorders, but are still clinically significant. And then we have unspecified depression disorder, and those symptoms do not fit the category, but can still cause the distress as well.
Okay. Wow. So there are like major types. There are a lot of types of depression. Um,
Mm.
Hopefully, when doctors do diagnose you, they do tell you what kind of depression that you are going through. Could you just take us through that? Do they tell you um that that you have this kind of depression? And there different treatments also for different types of depression?
Yes, there's different treatment for different types of depression. So also what we do, especially as a registered counselor, because for registered counselors we cannot diagnose, but we can actually try to prevent it from actually getting worse. So the moment we see that this person is going in through is going to go into a depressive state, so whatever lifestyle they're living or their negative thoughts is leading them to that state, this is when
Mm,
we step in to try
mm,
and prevent the person from going into the depressive mode and episodes as well. Right. But the moment the person has actually now in that state, you could see this person is depressed. This person is going through a lot of, is meeting the criteria for major depression disorder or even the persistent mood disorders as well. We then refer that person to a clinical psychologist or a counseling psychologist as well. So they are able to fully diagnose what kind of depression the person is going through. Sorry.
okay.
They're able to actually identify, and then they can be able to also, if it is a need for medication to be a part of the treatment plan, then they can also refer that person to a psychiatrist as well. So we kind of work in a dynamic field, so we can integrate all this intervention into one. So we can make one treatment plan to say the individual might need not just lifestyle changes, not just psychotherapy, but they also need medication. They need to be assisted in a way that it is holistic in itself as well.
Okay. Just tell us, why do you think, or what would actually make depression worse? What would make depression worse?
So there are various factors that we can look at, right? So a lot of times, if the depression is left untreated for a while, so lack of treatment, the individual then is left feeling stuck in that state. So remember, this is a hopeless state. So it's persistent negative thoughts this person has. It's persistent isolation. It's persistent inability to even have basic self-care, inability to eat, inability to have pleasure in anything in their world. So the moment they don't get any medication, treatment, or any intervention, then those people are left it can worsen from there as well. And this is where we have severe reactions from individuals. Right. We also have isolation. So avoiding any social interaction and withdrawing from loved one is one of the major causes as well. So sometimes we do preach that it's okay to actually avoid being around people. It's okay sometimes to have that moment for yourself. But what is not okay is if you withdraw and now you find yourself unable to function, you're unable to cope, and now you find yourself the more comfortable in that space where it is actually a lot of people will paint it as a dark zone in their life as well.
Hmm.
Chronic stress. So chronic stress is one of the major contribution to the worsening of depression. So we're looking at people who constantly are triggered from work, relationship, or financial issues. So the moment you are chronically stressed about those and you cannot find solutions, then it's a cycle. Remember, it's just go persistently going through. And a lot of people, when they are in that state, they want to find a way of coming out. So they want to find a way of living. And this is where a lot of people even go to the usage of substance abuse, which is also another contributing factor because now you're constantly stuck trying to find happiness where there is no happiness again. So once the alcohol
Hmm.
got does or the high goes down, you'll find yourself back in the depressive state and you want to go back again to feel happy as well, right?
Hmm.
Um, so we're also looking at poor sleep. So a lack of sleep or irregular sleep patterns do contribute as well. Because remember, we need to regulate our minds as well. We need to find a way to reset the mind. If you cannot reset the mind, you're going to be constantly thinking or overthinking about different things, right? Unhealthy diet, negative thought patterns, and physical inability are other contributors to the worsening of depression as well. So, we're looking at hormonal changes and medical conditions as well.
Okay. Now depression, is it curable or is it something that you will have forever?
Okay, so depression is treatable. Let me not say curable, but
Curable.
treatable,
Okay.
right?
Mm-hmm.
Because many people do recover fully, but however, they may experience in recurring episodes. And also they may need long-term management for depression.
Okay, so that will bring us into the treatment options that you're speaking about. What treatment options do we have for depression?
And so we have therapy. This is where we try to look at your cognitive behavior techniques. So we have the CBT technique. This is where we try to change your thoughts or change your behavior or your reaction to the situation that you're going through as well. We love your psychotherapy. So this is where we allow the person themselves to experience, to talk about what they're experiencing, to talk about their challenges, and to talk about all the. So we allow the person to actually be in that space and to actually be themselves as well. So remember, it is very unique. Depression is unique for each person. So allowing the person to actually experience or to talk about the experience is actually more therapeutic for them. So some of them find that, you know what, the more I talk about my problems, the more I can actually see that there's a solution. It's just that I wasn't tapping into the other spaces, tapping into the other parts of me that can actually bring me to the solution that I need. So your medication, we have antidepressants that can be prescribed by either your doctor or your psychiatrist as well. We have lifestyle changes. So for those people who experience depression due to the environment that they're in. So for example, if you're constantly, it happens, it's a cycle and it's it's sad for some people. You go to work, you come home, you eat, you sleep, you wake up, you go home, you go to work, you come home, you eat, you sleep.
Mm.
So it's just a pattern, and there's nothing exciting to look forward to. So we try to challenge those people to say, you know what, look at the different lifestyles that you can do. Try to change a pattern, one or two patterns that you have. Try to change the way that you can actually be. So maybe try to go to the gym. Try to do something exciting for yourself as well. We're looking at your social support. Do you have people around you who can actually talk to you? You can talk to, you can offload, you can say, I'm reaching out, and you know that this person will not judge you at that time.
Okay. Sounds like there's a varied number of treatment options that are available, and I'd just like people to know that they're not alone. Like there are a lot of treatment options that you can go through, things that can actually help you go through this depression. Like you don't need to suffer it alone. I just wanted to know, do you offer any psychological sessions? I know you said earlier that you're a counselor, but what kind of sessions do you offer? Just so we
All
can
right.
get clarity for people at home.
All right. So I'm in the EAP space. So I work with a company called Workforce Healthcare. Sorry, I see the logos up there. So we offer EAP counseling. So we work with various companies. So we do telephonic counseling, we do face-to-face counseling with those people as well. And we try to kind of help those employees as well that way. Right.
Okay.
So privately, I do not have a practice at the moment. So yeah, that's how I've been doing um my registered counseling gig.
Okay. I think people that's just will give people clarity at home that it's sort of done through workforce. I think everybody will be able to see that label that's over there or on the screen.
Mm.
Um
So, oh, sorry. Sorry. So it's not just workforce also. So we have different companies out there. There is your Momentum, there is your Lyra. So they affiliated with different companies as well. So it's very big. The EAP field is very big in itself. So a lot of people have those options as well. Also, if someone is experiencing depression and they don't have any resources, they can visit the farm SA. They can call SADC or Lifeline as well.
okay. All right. I think you just mentioned something that a lot of people might not have access to these resources and think, okay, no, so what can I do? We will have, I will link those numbers and those websites right after the show. We said SEDEC Lifeline, right?
And farm
Yeah.
SA, FAMSA. Yeah.
Okay. Um, Lastly, what's your advice to people that are going through depression?
My advice is be kind to yourself. That's one of the most important and basic thing you can have. Be kind to yourself. Remember, it is a unique experience. It might be universal, but it is a unique experience. How you experience it, the next person won't experience it that way. So do not rush yourself. Do not be hard on yourself when you're going through a depressive symptom or depressive episode. Do not feel like, people are going to judge me. Do not feel ashamed. If needs be, speak out. Tell people that I'm not okay. I'm going through this. Find some people who can support you during that phase as well. People you know that they will not give up on you, because it is a very challenging. It's very difficult for other people to support a depressed person as well, because there are many factors to consider. Other people might be suicidal. Other people might um, do drastic things to actually numb the pain that they're going through. So do not rush your progress. It's okay. If you're feeling depressed, it's okay to seek out help. And it's okay to know that it is my own unique experience and I will be okay.
Okay, that's sound advice, such great advice, and I agree with you. I agree with you 210%. I think it's good to be kind to ourselves and not be so hard on ourselves. It's one thing that actually leads to depression is just being so hard on yourself and just wanting things to be perfect. And reality is things will not. Like life will always hit you, and you need to just take it as it comes. Um.
Mm.
So how can people get a hold of you?
Right. So for those who have the EAP program, they can always call the toll-free line and try to reach out to us. For those who want individual counseling, I will try to do virtual sessions. They can reach out on my cell phone number. I don't know if I can call it out. It's
Yes,
zero
you
six
can.
seven 676 8233.
Okay. Maybe you'd like to repeat it again in case people did not get your number.
Okay, it's 067 676 8233.
Okay. So we'll also just link it in the description. Thank you so much. Thank you so much for taking this interview. I thoroughly enjoyed it. I learned a lot.
Mm-hmm.
I think we're at a time now where mental health is one of the most important things. So many people are going through mental health issues, and
Mm,
it's a pandemic actually. Like we're in a serious mental health pandemic where a lot of people are going through mental health issues. It's something that we need to be talk about. We need to talk about this like more and more and more and more, just so that people can get
mm,
to know about this, can know that there is help. You can get help out there. Um, Considering that suicide rates are also up, because people just don't know where to get help. There's help, there's
mm.
treatments out there. Um, there's We'll link all of the lines that are there. I'll give you her number again in case you didn't get it. Um, Thank you so much for this interview once again. Thank you for taking your time to do this.
It's a pleasure for me to